My name is Peter Lamb. I'm one of the physical therapists here in Barkman Smith Physical Therapy, and I'm here to kind of talk about part 2 of my series, okay? So I hope you all are having a great day thus far. You know, for me, it was another great day here in Barkman Smith Physical Therapy. Starting from the very first patient I worked with, you know, she was very motivating, very eager to go through therapy, and that just kind of made a great start of my day. So now let's get started with our topic for this evening: the role in physical therapy and spinal stenosis rehab, part 2. Spinal stenosis and some of the signs and symptoms associated with it. So I'm going to do a really quick recap on what I talked about last time. So last time I shared about some statistics on how common low back pain and neck pain occur to almost everyone. And then I also talked about what is spinal stenosis and explained that it is basically the narrowing of the spaces around the spine and also the symptoms associated with it, such as numbness, tingling, weakness, and pain as well. I also talked about particular movements that affect your back or neck pain, such as bending backwards, walking, looking up, standing up, generally make your pain worse. And then movements such as bending forward, sitting, looking down will reduce your pain. So that was a really quick version about what I talked about last time. If you want to learn more about what I talked about in my last video, check out part 1 in our past video sections via Facebook or YouTube. This time around, I'm going to go and talk about ways to help treat spinal stenosis and how physical therapy can help you. So the first thing I want to talk about is the mechanics of the spine, because the reason why I want to talk about it is because if I explain how the spine moves, then when I talk about treating it, it will make a little bit more sense. So I'm going to use this model to kind of help me explain that. Now, keep in mind, the mechanics of the low back apply the same to the neck. So even though I'm using this low back model, the concept is the same for the neck, okay? I hope you guys have a good view. So here is the spine. Here's the front of the spine. Here's the side of the spine. And then here's the back of the spine, okay? So kind of orientation-wise, this is what I'll be looking like if I look forward, sideways, and then backwards, okay? And I talked about this last time, but I just want to do a quick recap on the anatomy of the spine, okay? So you have your vertebrae, the bones, you got the discs in between them, and then you have the nerves. Then you have the nerves kind of sticking out of the spine, okay? So as we grow older, go back up, John. As we grow older, the disc between the vertebrae gets smaller, and that causes that gap where the nerve branches out to get smaller as well. Now, take a look at what happens when I cause that spine to bend backwards, okay? Notice that gap where that nerve is shooting out makes that gap even smaller, and notice how that nerve is being compressed, okay? Another movement that can cause that pinching movement is bending to the same side as the leg or back pain. So let's say I'm having pain on my right side. Notice again, if I kind of tilt to the side, see how that kind of pinches that nerve there? Because that nerve is being compressed, those radiating symptoms, the numbness, the tingling, the weakness I mentioned in my last video will tend to get worse. That is why bending backwards, looking up, standing, or even walking tend to make it worse. It's because these movements create that bending backwards movement that causes that nerve to be pinched, okay? Now, take a look when I go the opposite way. So, when I bend forward, look at how that space gets even larger and that nerve gets a break from all that compression. See, there's a whole bunch of room right there, right? So also when I kind of bend the opposite way, that really kind of gives it the most amount of space that you can get, and it creates that same opening pattern as well. That is why things like bending forward, looking down, sitting should help alleviate your pain. It's because all those movements create that opening pattern for your spine. Okay? All right, I'm gonna step back now and put this spine over here. Okay, I hope you got a really quick anatomy lesson out of that. So now I want to talk about the role in physical therapy in battling stenosis. Now, unfortunately, physical therapy cannot reverse stenosis. I really wish that it could, but it simply cannot reverse that natural aging process in our body. Now, what physical therapy can do is we can provide exercises to help better support the spine, such as strengthening the muscles around the spine, improving the range of motion on your back and your neck, and then try our best to kind of help transition to all the goals that you want to accomplish. We can also perform, manual techniques and positional strategies to kind of help reduce your pain as well. Okay. One thing that physical therapy can help with is to facilitate that opening pattern. Okay. Here are some things that can help with that. So the first thing I want to talk about is traction. Okay. So traction is basically the idea of creating a separating force in the back or the neck to help relieve some of that pressure in the low back or neck. So look as if I'm trying to kind of compress it, and then when I separate it, you see how it kind of creates more space on that spine? So that's something that we can do. So there's two ways that we can do that. So we can do it manually. That's where, a therapist like myself kind of create that force. I can do it for the low back as well as the neck. We also can do it mechanically, where we use a mechanical device to create that same force. So things like a traction unit, an inversion table, things like that to kind of help create that separating force on the spine. So if you guys are actually interested to learn more about traction, drop a comment down below and let us know. Another thing we can do is positioning techniques. Now, I'm going to need some help for this one, so I actually grabbed one of a good guest of mine, Mr. Robert Harbour. Come on in. How are you today, sir?
Doing just fine, Peter.
Awesome. So he's going to help me kind of go through some of these positional strategies, okay? So just kind of break the ice a little bit, Robert. You want to hear a joke?
Go.
Okay. So what do you call a back that's lost 75% of its integrity?
What do you call it?
A quarterback. All right, that's my pun of the day. Okay. Anyway, sorry about that. All right, so moving on. So Robert, I'm actually going to have you turn the opposite way, okay? Because I want the viewers to view the back, okay? So turn around over here. Nope. So upward, and then you're going to face that way to the wall, okay? So these positioning strategies work best for low back stenosis, so low back pain, and when you have pain going down one leg. All you need is a pillow and something to lay on, okay? So let's say Robert has pain going down his left side, okay? So step one, you're going to roll up the pillow to a burrito, okay? We're talking Chipotle burrito, not Freebird's burrito. As you can see, I have a bias. Okay, so then you're going to put this pillow on the same side as the hurt side. So remember, on the opposite side of the hurt side. So if Robert's having pain on the left side, I'm going to put the pillow on the opposite side, like that, okay? Then, Robert, you're gonna lay on your side and kind of where the pain is on top. So he's gonna lay where those radiating symptoms are gonna be on the top side of the table, okay? So if you're doing this right, you're gonna feel a good stretch on your low back like that. Okay, so I'm actually going to use this monitor to kind of help me show what's actually going on while he's doing this, okay? So we might need to come a little bit closer. Come closer. See what I have to show you guys. So as he's kind of laying on the stretch, it's creating that kind of same side bend movement, okay? So as he's laying there, it's kind of stretching out the side like that, and you can see how it kind of creates that opening pattern that we've been talking about, okay? Okay, that's good, put it on. All right, so as he's kind of holding that stretch, it kind of really helps relieve some of his back pain, and then if you're doing it right, then you might kind of feel some of those radicular symptoms kind of slowly creeping back up to the low back, okay? That's when you know when it's feeling good and it's doing it correctly, okay? All right, come on up, Robert. Keep set up towards me. Okay. All right, another thing that physical therapy can do is provide some stretches that you can do at home to help create that opening pattern, okay? So here are some basic stretches that you can do for your neck and back. Okay, so the first one we're going to do is called a forward bending stretch. Okay, so I'm going to grab this chair here, and Robert, you're going to have a seat right here. We might have to lower the camera just a hair. So this can be done kind of seated or standing, but ideally you're basically just going to be bending forward. So Robert, what I want you to do is I want you to bend forward and reach for your toes. Feel a really big stretch on your low back. And remember I told you, bending backward feels good. So we're creating that opening pattern like this, and it's kind of really giving a good stretch on your low back, okay? And ideally you want to try to hold this for about 30 seconds and really trying to feel that relief on that pain. And if you're lucky, if the pain on your leg kind of starts to creep up towards your back, that's a good thing. We want that to happen, okay? All right, come on up, Robert. All right, another thing that we can kind of show you is kind of a single knee or double knees to chest, okay? So Robert, I'm going to kind of lay on the table here. Okay, and he's going to lay on his back. Same concept as the forward bending stretch, but this can be done lying down. So you can do this when you're just waking up from the morning, or you can just or whenever your back is really hurting or you're just laying down. This is a good stretch to do. Okay, so first thing you're going to do, Robert, is you're going to grab one knee towards your chest. Okay, and you're going to pull that chest towards your chest, and you're going to feel a good stretch on your low back. Okay, where do you feel that stretch, Robert?
Feel it out here.
Awesome. So he's feeling it right, okay? So he can do it on one side and then he can switch to the other side. Kind of like that. And you feel the same stretch on both sides, but then you can also do both knees at the same time. I hope your pants won't rip, Robert. Okay, and you're gonna pull, and you're gonna try to feel that stretch on your low back. Again, same concept, facilitating that opening pattern, okay? You should feel that stretch on your low back, okay? Sit up. All right, so the last stretch I want to show you guys is more so for the neck, okay? I call it the smell your armpit stretch, okay? So first thing we're gonna do, it's a good stretch for your neck muscles, and also helps, again, facilitating that opening pattern for your neck, okay? And I'll kind of do it with you, Robert. So we're going to pretend that we have pain on our right side. So raise our right hand up, Robert, like that, okay? Ow, it hurts, right? Okay,
It hurts.
okay. Coming down. So what you're going to do is we're going to tilt our head kind of to the side away from the radiating symptoms. And then you're going to turn your head to the same side. So we're going to do a turn as if you're looking at your armpit, okay? So again, you're going to feel that stretch on some of the muscles on the base of your neck. And if you're lucky, you might feel some of your radiating symptoms kind of creep back up to your arm towards your neck. Now, another way that you can kind of feel a better stretch is as you go, kind of put some overpressure over your head. So do this like with me, Robert, and really grab your hand, pull on your neck, and really give it a really good stretch, okay? This is where the smelling the armpit comes from. It's like you're smelling your armpit, just like that. I put on deodorant. Robert, did you?
Yes.
Good. All right, very good. Okay, so these are just some very basic stretches that you can do to hopefully help relieve some of your pain. Robert, thank you again, man. Give it a round of applause for Robert. I'm the only one clapping, but I know you guys are clapping out there as well. Okay, thanks, buddy. All right. Now, there will be some cases where physical therapy will not work alone. I wish I was that good, but sometimes PT alone can't help your pain, okay? Go back up, John. This is where we would collaborate with other healthcare providers in the medical field, such as your primary care physician, a spine specialist, or a neurologist, and help find a treatment plan that works with you, okay? Sometimes your doctor might prescribe medication or perform a steroid injection to help your neck and your back, in conjunction with physical therapy, and that might be the perfect mix for you. There can also be times where the doctor might perform surgery to your back and your neck, and then PT can kind of help you after the surgery to help regain your strength and get you back to what you're doing before the surgery and hopefully before the pain. You know, physical therapy is only one piece of the pie, and sometimes it takes a village to help your plan of care, okay? Now, kind of coming to the end of it, I do want to kind of put this disclaimer. So to everyone watching, this video is not meant to completely treat your pain specifically. I do believe that the pain is a very complex structure and there are multiple factors that contribute to your pain that physical therapy cannot address, such as heart problems, kidney problems, or tummy problems. So with that in mind, it's always better to be fully screened and assessed by a medical professional, such as your primary care physician, your orthopedic specialist, or even myself, a physical therapist, okay? And with that, that's all I have for you guys. So any questions? Please don't be hard questions. In fact, throw it all together. Throw all the questions you can. I'll try my best to answer as best as I can. If there are any questions.
Radiating symptoms on both sides.
Okay. So one question that we have here is, what happens if you have radiating symptoms on both sides? That's a really good question. So some things that we can help with, I would usually like to primarily attack the one that hurts the most. So usually if it's one's hurting more than the other, I would like to address, the one that's hurting the most first. So, kind of present that opening pattern on the other side to kind of help relieve some of that pain to improve your strength, your range of motion, and things like that. Can you prevent spinal stenosis? That's a very hard question. I do believe that you can, unfortunately, but like I said in my last video, spinal stenosis is just the natural aging process as we grow older. Now, there are some ways that can help prevent and kind of prolong your integrity of your spine, such as exercise, diet, stress levels. All can definitely help prevent that kind of degeneration on your back for as long as possible. At what stage of your life does spinal stenosis typically occur? So usually you would kind of notice those symptoms happening as the older you get. I want to say there's a particular age group that is, once you have that age, once you hit that age, you have spinal stenosis. It's more of a, how have you been taking care of your body? Have you been strengthening it? Have you been eating correctly? Kind of piggybacking from my last answer, those things kind of help prolong that occurrence of spinal stenosis. But generally, kind of big picture wise, the older patients usually kind of start having stenosis on their low back with good reason. If a 70-year-old person has back pain, they have a 70-year-old spine, so that can definitely there's going to be some slow deterioration and degeneration on that back. So does scoliosis affect spinal stenosis? I honestly think it can, because scoliosis is basically, where's my model? Scoliosis is basically that curving of the back, and you can see it from here. That causes a pinch in the spine, and I can see that kind of cause radiating symptoms down your low back. Now, does it affect spinal stenosis? Yes, I do agree with that. Yeah. Now, in order to help kind of relieve that, our goal would be to kind of reverse it. So if you have that curvature on that spine there, our goal was to theoretically kind of get you back upright. Now, depending on how long you had the scoliosis, this could be set in stone. And, but again, like I said, we can at least kind of stretch the muscles around the spine to kind of help, position your spine a bit better. But it is difficult, especially for someone who had scoliosis for a long time. Are there activities or recreationals that I should do are there activities I should avoid if I have spinal stenosis? So anything that requires you to bend backwards. So remember, bending backwards generally makes the back pain worse. So in terms of recreational activities, I would say, picking up and reaching upward, walking can also kind of make it bother, because as you walk, you have a slight kind of bending backward motion as I bend backwards, and that can also aggravate. So I would also say prolonged walking. So now I'm not trying to say stop walking in general. I would just say take breaks in between. So, if you are having pain after 5 minutes of walking, then cut it down to 4, take a break, and then try to do 4 again after the back calms down. It's hard because because the integrity of that spine is degenerated. It's hard to avoid it, but you try to manage it as best you can with the stretches, with the positioning techniques, and things like that. Can you have disc problems and spinal stenosis at the same time? Of course. I do think, in fact, I think having disc problems leads to having spinal stenosis. I remember I read this article where, they talked about where spinal stenosis occurs because, if you had a history of a herniated disc and it's not rehabbed correctly, if you kind of wait down the road, you could have spinal stenosis on that same level. So you can have disc problems and spinal stenosis. Now at the same time, of course, never say never and never say always, right? So I can always see a scenario where you're having disc problems and spinal stenosis at the same time. Keep them coming, keep the questions coming. Okay, so one person asked, how do I request therapy for my back pain? Do I need a referral? Not necessarily. So you can, if you're ever having back pain, you can kind of go to your local physical therapist facility, i.e. here, and just kind of get a good quick screening. And we can do kind of evaluation without the need of a referral from your primary care physician. But after we do the evaluation, it is good to have a referral afterwards. But in terms of do you need a referral? Not necessarily. I would just give us a call. I don't know our phone number on the top of our head, but I know it's down lower in the script here in a bit. Oh, there it is. Okay, our phone number is 817-283-9435. And if you ever have back pain, just give us a call and just say, hey, I'm having back pain. I would like to schedule an initial evaluation for my back pain. Okay, and like I said, if you are interested in getting screened by a physical therapist to see if you have spinal stenosis, you can reach us by phone at 817-283-9435 or email info@barkmansmith.com.